Welcome everyone, my name is Iman and I'm from the Youth Alliance for Sexual and Reproductive Rights, YASA for short. We're advocating for stronger, fairer abortion laws in New South Wales. And as the group legal expert, I'm here to walk you through what's recently changed and where the gaps still are, and what we are fighting for next. Abortion is a human right. That's not just our opinion, it's grounded in international law. Article 16E of CEDAW gives women the right to decide freely on the number of children and if they want children, and to have access to the tools and education to do so. Yet in Australia, this right is still up for debate. When we constantly subject abortion to political scrutiny, we strip it of its status as a right and treat it like it's a preference. But like the freedom of religion or speech, this is about personal autonomy. You don't have to agree with someone's right or someone's decision to be able to respect their right to make it. Let's backtrack briefly. In 2018, a woman in New South Wales could face up to 10 years in prison for terminating a pregnancy. The only legal defense was if continuing the pregnancy posed a serious health risk to her. In 2019, abortion was decriminalized. It was a step forward, but it wasn't exactly the finish line. By 2022, only 3 out of 220 public hospitals in New South Wales offered surgical abortion services. That's when the Senate launched its inquiry, because the problem wasn't just legality anymore, it was access. The Senate's 2023 report said it plainly. Access to reproductive care shouldn't be a postcode lottery. If you live in a metro area, access might be easy, but if you live in rural, regional, or are relying on public hospitals, good luck, because you will need it. There is no legislative or regulative requirement making public hospitals, perform this service. The report recommended that all public hospitals should offer surgical abortions, or at least create real affordable pathways to providers nearby, because otherwise this right is quite literally meaningless. Since then, we've seen some key updates. In 2023, prescribing restrictions on the abortion medical pill was lifted. Now, trained nurses and midwives are able to prescribe it, and it can be dispensed at any pharmacy. This is huge, especially for rural patients. In 2024, pharmacists began offering a 12-month refill for contraceptive pills without needing a GP appointment. Also huge. We love it. And this year, we saw the Abortion Law Reform Amendment Bill 2025, which aimed to improve access across New South Wales. The bill proposed statewide access, nurse and midwife prescribing rights, mandatory referrals from objecting doctors, and better protections for vulnerable patients. But guess what? Only one reform was actually passed, which allowed nurse practitioners and midwives to prescribe the abortion pill up to 9 weeks. Helpful, yes, but also just bringing state law in line with federal changes from the year before. This is progress, but it's crumbs. Compare that to the ACT or Queensland. In the ACT, not only can nurses and midwives prescribe pills, there are free abortion services, free long-active contraceptives, and mandatory referrals from objecting doctors. New South Wales has a long way to go. Because let's be clear, legal does not mean accessible. Abortions can cost anywhere between $300 to $8,000. Many doctors and hospitals can still refuse to provide them, and regional areas lack trained providers altogether. If you can't access or afford it, do you really have a right? Even contraception access is limited, which only increases the demand for abortion down the line. So what is YASA calling for? Drawing from the reforms of the other states and the inquiry recommendations, YASA is advocating for universal, publicly funded abortion services, bulk billed so that cost is not a barrier, mandatory provider training in abortion and contraceptive care, mandatory referrals from objecting doctors, just like the other states, a national telehealth abortion service so that rural areas are not left behind, and formal commitments so that every region has some access, whether that's via clinic or referral pathway. This is about equity, dignity, and actually enforcing a right that already exists on paper. Abortion is legal in New South Wales, but it does not mean that it's available, or fair, or safe. Yas's campaign is about closing the gap, because rights don't exist if they can't be exercised. Thank you for listening, and we thank you for supporting our cause.